The following video shows the findings of a patient with COVID-19. It is a 63-year-old patient who is currently being ventilated in the intensive care unit of a hospital. Pre-existing conditions are known: hypertension, obesity, and gout. There is no history of bronchial asthma or heart disease. The aim of this presentation is to use nonlinear system analysis to search for any previous illnesses, with the question of what disorders are present, how severe they are, and whether there may be also energetic stresses that are not detected by conventional diagnostic methods, but which play a role as a risk factor for disease with COVID-19. First, we will briefly deal with the logic of nonlinear systems. Nonlinear systems measure information, not morphologies, as in X-ray or ultrasound examinations. With regard to coronavirus, this means that the system searches for information typical for coronavirus, not for RNA fragments, as is currently done in regular PCR tests. The energetic states of organs are described with colored symbols. As shown in this figure, subdivisions are made from grade 1 to grade 6, according to school grades, where 1 is very good and 6 is insufficient. The darker the graphic symbols on an organ in the following illustrations, the energetically weaker the organ, and vice versa. We begin with the diagnosis of the infection by coronavirus SARS-CoV-2. This picture shows lung tissue with two figures. The upper illustration shows the initial energetic findings, which mainly correspond to grade 4. If the coronavirus is inverted by removing the information of the virus from the observation in a so-called Vigito test, the image below is obtained, which is 28% better than the above initial result. The lower picture shows how much better the energetic result would be if the corresponding information of the coronavirus was not available. This statement is to be understood purely diagnostically and not as a therapy. The numerical value of 28% is shown in the figure below. The higher the improvement value, the more valid the result, and vice versa. At this point, the patient is visibly ill and shows the typical symptoms of coronavirus, such as fever, dry cough, shortness of breath, loss of smell, and general indisposition. The image of the tonsils shows an energetically good result. With inversion of coronavirus, the second result improves at the bottom by only 1%, which can be considered as non-significant. This means there is no information of coronavirus on the tonsils. The lymph nodes are low with 19% of coronavirus. The red bone marrow is heavily contaminated with a clear 45%. Also, the spleen shows a clear energetic disturbance, which is improved by 43% by invasion of coronavirus. The imaging of the so-called chromophilic adenocytes is interesting. Chromophilic adenocytes represent a cell structure in the pituitary gland and correlate best with the condition of the patient. If one wants to know, with the help of NLS analysis, how a patient is clinically up to date, it is recommended to search for the chromophilic adenocytes. The value of 51% displayed here indicates that the patient is in a poor condition. The following analysis now refer to the question of which previous diseases or risk factors the patient suffers from. The first risk factor is a clear exposure to the fungus Candida albicans in the area of the GI tract with the resulting immunological disturbance. The image of the stomach shows a clear energetic disturbance, which is improved by 45% by inverting Candida albicans. Thus, a clear exposure to this fungus has been proven. Similarly, exposure to Candida albicans is found in the intestine. In the case of inversion of Candida albicans, a theoretical normal result is obtained. This means if the intestine were to be rehabilitated, the energetic situation of the intestine would be normal again. Exposure to Candida albicans in the GI tract typically has 4 causes: a diet too rich in carbohydrates, antibiotic therapies, stomach protection products of conventional medicine, or natron powder. The latter reduce the acid production in the stomach or bind the acid. The physiological acid protection is no longer available, and the GI tract is flooded by foreign germs ingested with food. Colonization with Candida albicans is the typical consequence. The energetic disturbance in the stomach and intestines results in a disturbance of the microbiome and thus a resorption disturbance in leaky gut syndrome. The intestine literally becomes full of holes. Food components are absorbed which would otherwise not be absorbed and energetically burden the next station, namely the liver. And so there are numerous grade 4 markings on the liver in the form of downward pointing red triangles. If the GI tract were rehabilitated and Candida albicans treated, the energetic findings of the liver would improve by 28%. Typical liver symptoms are fatigue, sleep disorders, visual disturbances, sensitivity to light, and the emotion of anger and rage. And so, on the cross-sectional view of the skull, the visual disturbance and fatigue can be seen in the form of individual red triangles, both in the area of the optic nerve and in the brain. If Candida albicans is inverted, the energetic constellation improves by 27%. The energetic disorder of the liver leads to a reduced breakdown of the food components that were incorrectly absorbed due to the intestinal disorder. Correspondingly, there is an accumulation of metabolites in the tissues such as muscles, tendons, ligaments, and joints, as can be clearly seen in this picture in the shoulder joints, but also in the muscles of the shoulder girdle. These energetic disturbances are ultimately an expression of microinflammations in the context of a rheumatic process, ultimately triggered by the underlying intestinal disorder. The rehabilitation of the intestine or the removal of Candida albicans would not only lead to an improvement of the energetic situation in the intestine and liver, but also to a reduction of the inflammatory changes in the shoulder girdle area and to a disappearance of the rheumatic complaints. The same applies to the eyes. According to the teachings of Chinese medicine, the eyes are attached to the liver, and so it is understandable that by inverting Candida albicans, the energetic constellation of the eyes would improve by 23%. The second risk factor is a rheumatic disease caused by streptococci. This figure shows an energetic disorder in the area of the paranasal sinuses, which improves by 47% when Streptococcus hemolyticus is inverted. Also in the area of the larynx, the trachea, and even in the thyroid gland, energetic disturbances caused by Streptococcus hemolyticus are found. The value here is 70%. Streptococci can also be found in the stomach, where the energy situation improves to a total of 51% after inversion of Streptococci and Candida albicans together. Also, the liver improves further by a total of 31%. The heart muscle is loaded with 29%, the coronary vessels by 58% and 52% respectively. It cannot therefore be ruled out that the patient suffers from coronary heart disease. The rheumatic problem caused by Streptococci in the skeleton is very clearly shown with 40%. Both hip joints are also affected, more strongly on the left than on the right side, with 46%. In the area of the hands, as well as in the area of the knees, there is a clear strain of Streptococci. Clinically, considerable rheumatic complaints can be assumed here. The third risk factor is the miasma of tuberculosis. The term miasma of tuberculosis, or the inflammation of the corresponding bacterial pathogen Mycobacterium tuberculosis, originates from homeopathy. It assumes that every pathogen is an information carrier and that this information persists in the organism, even if the corpuscular part of the pathogen is no longer present. Such information continues to burden the organism and can even be inherited in subsequent generations. Even if a person has never suffered an infection from Mycobacterium tuberculosis, the inherited information alone is enough to still trigger the symptoms typical of tuberculosis. We will study this in the following figures. The third risk factor is the miasma of tuberculosis. The term miasma of tuberculosis, or the inflammation of the corresponding bacterial pathogen Mycobacterium tuberculosis, originates from homeopathy. It assumes that every pathogen is an information carrier and that this information persists in the organism, even if the corpuscular part of the pathogen is no longer present. Such information continues to burden the organism and can even be inherited in subsequent generations. Even if a person has never suffered an infection from Mycobacterium tuberculosis, the inherited information alone is enough to still trigger the symptoms typical of tuberculosis. We will study this in the following figures. Tuberculosis is most evident on the bronchial tubes, and when Mycobacterium tuberculosis is inverted, the energetic result is improved by 65%. This stress leads to an increased susceptibility to infection, as is the case for the coronavirus. Just as the infection of tuberculosis typically affects certain organs preferentially, the information of Mycobacterium tuberculosis can also be found on the same organ structures. After bronchial tuberculosis, it is renal tuberculosis, which is the second most frequently detected. Looking at the figure, an informational burden of 43% is shown in the form of downward pointing red triangles on the kidneys, but also on the adrenal glands. The traditional Chinese medicine describes the kidneys as the seat of the life energy. And indeed, experience teaches that people with an informational burden of tuberculosis on the kidneys have limited life energy and are correspondingly more susceptible to infection than others who have good kidney energy. This picture shows the right kidney, whose energetic situation can be improved by 33% by inverting Mycobacterium tuberculosis. If the miasma of tuberculosis is eliminated, the energetic constitution of the patient improves. The adrenal glands are also burdened by tuberculosis. Here the value is 35%. An energetic disturbance of the adrenal glands typically leads to blood pressure regulation disorders, often with too high, too low, or even repeatedly changing blood pressure or arterial hypertension and hypotension. The inflammation of tuberculosis typically also leads to disorders of weight regulation, usually combined with a tendency to be overweight. This constellation can be seen very well typically on the Langerhans islet cells of the pancreas. This is where insulin is produced, the hormone that decides on the utilization and storage of carbohydrates. In the present case, the energetic load of Mycobacterium tuberculosis is 11%. The fourth risk factor is psychological stress. In this figure, the brain ventricle is shown with an energetic disturbance which improves by 19% after invasion of shock by COVID-19. The brain ventricle is the structure where mental stress due to shock events can be best represented in the NLS analysis. This means that the diagnosis of COVID-19 has caused a shock in the patient. Thus, a whole range of risk factors predisposing this patient to infection with coronavirus can be found. First, there is a limited immune defense due to fungal exposure to Candida albicans in the GI tract with consecutive restriction of liver function. Second, there is a rheumatic disease caused by Streptococcus hemolyticus with involvement of the heart and coronary vessels. Third, there is the miasma of tuberculosis with obesity, arterial hypertension, and bronchopulmonary weakness. Fourth, finally, there is also a psychological burden caused by the diagnostic shock. Summary. First, nonlinear system analyses are not only suitable for the diagnosis of corona infections, but also for the analysis of previous diseases that increase the risk of corona infection. Second, in the present case, a whole series of energetic disturbances are found, which must be considered risk factors. The large number of risks explains why the patient became so seriously ill, even at the relatively young age of 63 years, that he even required artificial respiration. Third, many risk factors that predispose an infection with coronaviruses can be identified with the help of NLS analysis. This is especially true for those disorders who are only noticeable in the energetic informational analysis, but not in conventional diagnostics. In the present case, this applies in particular to the miasma of tuberculosis. Fourth, the quantitative finding of inversion in LNS analysis correlates not only with the validity of the tested causality, but also with the severity of the clinical symptoms. Fifth, NLS analysis is performed by remote analysis without personal presence of the patient. Name, forename, age, and address are sufficient data to start analysis. Neither a blood sample nor a throat swab is required. Sixth, the result of an NLS analysis is available within a few minutes. Take a look at the internet on www.healing-codes.com. There you will find further information on the topic of nonlinear system analysis, remote analysis, and the possibilities of energetic informational discharges. Thank you very much for your attention.